Okay, take two and call us in the morning. Your favorite twin doctors, Dr. I and Dr. J, are back with answers to your burning health questions. Guys, I'm guessing both of you escaped snowy Chicago to go to paradise this week. I hope so.
I am in St. Croix and loving it. I hear the ocean pounding as we speak.
And I am in Chicago in the hospital call room, and I had to fight all of that snow this morning.
You're feeling my pain then. No matter where you are, always good to have you. Let's get to it. We talked about this one before break. True or false? If you experience hiccups after eating certain foods, you may actually be allergic to those foods. And I'm going to say big true to that.
That's a big truth. So you have to think of hiccups this way, right? Hiccups oftentimes are benign, not a big deal. But sometimes hiccups are our way of, or our body's way of telling us, hey, there's something inside of me. I don't want it. I want to get it out. And so it will rhythmically, spasmodically cause contractions of the diaphragm, basically saying, get this out, right? And so what happens when some people have food allergies, they develop something called eosinophilic esophagitis. They basically get inflammation of the esophagus. And one of the hallmark signs of this is they will persistently hiccup. Now, the way you can kind of tell the difference between just hiccups and eosinophilic esophagitis, food allergy-related hiccups is they tend to be persistent. So you don't just hiccup for a minute, 2 minutes, 3 minutes. They just go on and on and on and on. And you tend to notice them when you eat the food that you're allergic to. So if you think, hey, maybe it's a food allergy, take an allergy medication, number one. Number two, tell your doctor. You're going to say, I know you think I'm crazy, but every time I eat eggs, I have hiccups. We can actually do food allergy testing to see if you are allergic to those foods. But yeah, actually, eosinophilic esophagitis, persistent hiccups, food allergy, potentially an early warning sign, beware.
Yeah, I'm slow nodding because this is exactly what happened to me. I got those esophageal spasms, and it taught me that I now have an adult onset allergy to shellfish, which is tragic and devastating. True or false? Let's get to this one. Taking birth control pills is the best way to delay menopause. We've been talking menopause this morning. I'm going to say true.
That is false. That is false. There really isn't very much that you can do to delay menopause. So the age at menopause is largely determined by genetics. So the age that your mom was, older sisters were, that's what's going to determine your age at menopause. Now, there are some benefits to being able to delay menopause. You can have less osteoporosis, less heart disease, less high cholesterol, but there are some downsides. You're going to have a higher risk of breast cancer and uterine cancer because of prolonged exposure to hormones. Now, some folks want to delay menopause, some folks don't want to. There's not a way to do it now, but there are some things on the horizon. There's something called ovarian cryopreservation, where they take a bit of your ovary when you're younger, freeze it, and then they put it back into your body when you're older. That will allow you to preserve fertility and to postpone menopause. And there's actually an immunosuppressant medication called rapamycin that they have found in animals delays menopause. So while there aren't any mainstream ways to do it now, it is on the horizon. So people need to start thinking, do I want to delay menopause and have some of those health benefits, but also some of those health risks? But it's coming. It's coming.
Isn't science just miraculous? I mean, it's like, what are you talking about that's going to be a possibility? It's wild. Forget expensive medications and fancy surgical treatments. Aspirin is the most effective treatment for chronic lower back pain. I'm going to say true to that one as well. I'm just going to go on a true streak today.
Hey, it's true. You know your medicine. You've been hanging out with us too long. So basically, it's an oldie, goodie, and cheapie, right? Aspirin. So if you think about it, like, first of all, low back pain is a pain, no pun intended, right? 1 in 4 Americans suffer from low back pain, and we spend about $10 billion every year with all of these different fancy treatment modalities, medications, surgical procedures, devices. And what a study recently found was they did this meta-analysis where they looked at over 300 studies. And what they found was patients had more reduction in pain, basically using a subjective pain score, when they just used aspirin and nonsteroidal anti-inflammatories. Now, it makes sense if you think about it. When you have back pain, basically inflammation is either a proximate cause or a secondary manifestation of that back pain. So when you take aspirin or a nonsteroidal anti-inflammatory, it gets right to the heart of the problem. It diminishes inflammation. Back pain results. I can tell you somebody who had back pain. I used to have a bulging disc in my neck from lifting all of these weights, and it literally kept me up at night crying. And then a nonsteroidal anti-inflammatory, massage, PT, gone.
Well, my husband needed to know about the aspirin about 2 weeks ago. He threw out his back just picking up the baby out of the crib. It's that time of life that we've entered now, I guess. Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.